the president and his wife testing positive, along with a member of the administration, Hope Hicks. So for more on this, we're joined now by Dr. Tom Tsai, assistant professor in the Department of Health Policy and Management at the Harvard Global Health Institute. So Dr. Tsai, I have to ask you for your reaction to the news about the president. Do you think that it was inevitable that he was going to be testing positive for coronavirus, particularly given all of the rallies and campaign events that he's been going to that we have all seen as being maskless and without too much social distancing?
Yeah, thank you, Kristin. As a clinician, the hope is that nobody more than necessary ever needs to come down with the coronavirus, and we can rapidly fight this pandemic back. But the example of the president and first lady testing positives does present a cautionary tale and reinforces the importance of good public health interventions. Even with the president who has daily testing and surrounded by staff who gets tested frequently, if there's any lack of vigilance around masking, around physical distancing, hand hygiene, there's still a risk of contracting coronavirus. But it also does show that if you test frequently, and this is the stage of the epidemic that we're in now, where we have extra testing capacity, they can identify cases early and prevent these isolated infections from spreading into a much larger cluster. So I think that's the important piece to focus on, is that this is an example of what a very robust testing strategy can tell you, which is give you the information that you need to act on to prevent further infections.
So, Doctor, yesterday we were talking to Dr. Andre Campbell from over at UCSF, and he was saying that he viewed those campaign events, those rallies, which actually, preceded Herman Cain's death, that rally in Tulsa, Oklahoma. He called them super spreader events. We actually now have news from the Trump campaign. They said, quote, all previously announced campaign events involving the president's participation are in the process of being moved to virtual events or are being temporarily postponed. Is that the right call? I mean, I have a guess on what you're going to say, but really going forward, should all campaign and political events just be virtual to really make sure that folks aren't going to be getting infected with coronavirus or perhaps spreading it to others?
Yeah, I think that's absolutely the right call. And for several months now, we've seen the virtual Democratic convention as an example of that. That the move towards virtual helps protect the safety of those voters and the general public. So especially these rallies that are indoor with high frequency, high duration of contact, with indoor settings that may have poor ventilation, that's a recipe for a super spreading event, as Dr. Campbell has mentioned. So that has been the ongoing concern over the last few months. And today's example in the news overnight really drives home what the cost of that not following that guidance should be. So I think moving forward, relying on virtual events is important. In areas where there's low community transmission, there's still opportunities for outdoor events. I wouldn't call them rallies, but more smaller scale town halls, that are outdoor based for the campaign to interact with the general public.
Now, I do want to ask you this news. I know that the president is experiencing mild symptoms and you aren't his doctor, but I want to know, how concerned were you when you heard that news, and how concerned should the American public be that the president has coronavirus, one, given his age, and two, given his weight? And I don't say that flippantly, but I only mention them because we do know that age and weight are comorbidities for this virus. Is that concerning and alarming to you?
It is concerning. We know that individuals over the age of 65 and those with other medical conditions such as obesity or underlying lung disease are at higher risk of adverse outcomes from having a coronavirus infection, including being hospitalized, maybe even needing a ventilator. And we also see it reflected in higher mortality rates as well. So it's not alarming yet. These are population level numbers, how the coronavirus affects every individual individual is very, very variable, ranging from asymptomatic, to people coming down and succumbing to the illness. So we don't know. I don't think it's right to get ahead of ourselves here. But again, it does show the importance of staying vigilant to help prevent the infection. So the president is at a higher risk, but right now all we know is that he has mild symptoms.
Now, this news, of course, came right ahead of a rally that the president was supposed to have actually in Wisconsin, both in Grand Rapids and also La Crosse. And those are two coronavirus red zones right now. And across the country, we are starting to see these upticks and these surges, these red zones start to increase. An Axios report just yesterday said that the coronavirus was actually increasing in 25 states in the United States. So half of the country right now. Is this evidence at all, or do you see indicators right now that we are perhaps either in the middle of or at the start of a second wave for this virus right now?
Yes, Kristin, we're definitely heading the wrong direction. The number of cases had been going down over the last several weeks, but a variety of factors may be contributing to the increased cases we've been seeing. We're now averaging over 45,000 cases per day. It's just by testing over 900,000 tests per day. And according to the Harvard Global Health Institute COVID-19 risk level dashboard on globalepidemics.org, there are now over 10 states that are in our red zone, meaning over 25 per 100,000 new cases daily on a 7-day moving average. So all these indicators are pointing the wrong direction. Now, we're also a few weeks out from some of the increased travel that we saw during Labor Day. We have universities that are opening, schools that are opening, as well as the economy that's reopening. For example, the news from Florida over the last week about bars and restaurants reopening again. So again, my worry is that these rise in new cases may mean in 2 to 3 weeks a rise in the number of hospitalizations, and a few weeks after that a rise in fatalities again. So we are still not out of the woods. And it's important to really, double down and really expand our role of testing and moving from a diagnostic framework, just confirming individuals with symptoms, and moving to an active playing offense by screening asymptomatic individuals to truly suppress the pandemic.
I have time for one last question with you, Doctor. And I wanted to ask about the vaccine. Moderna is saying that we aren't going to see a coronavirus vaccine, at least widely available, until March of next year. Does that sound far more plausible and in line with some of the estimations that you and other doctors and public health officials have been making, at least compared to that November target date that some of us had been hearing about?
Right. So there's two things to consider: is when a vaccine may physically pass phase 3 trials and be approved under an express authorization. But the more important matter is really two factors. One is the efficacy of the vaccine itself, and then two is the coverage, is how widespread of the population can we actually get vaccinated. Because we have to remember, it's not that vaccines that save lives, it's actually vaccinations that save lives. So it's critically important to make sure we get the vaccines to the high-risk groups of individuals. And it's also important to remember that there is not a single vaccine that is going to reach 100% of the population, that we may require multiple different vaccines who may be coming online on different timelines. And until we have a wide enough coverage with vaccination rates, we still have to make sure that we still follow through with testing, contact tracing, physical distancing, and masking. So, we are not out of the woods yet, even when the vaccine does come. Most people are anticipating that, the pandemic will be with us well into 2021.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.